Jalila Children's Hospital Pediatric Plastic Surgery Department was started in 2019. We are the only team that exclusively focuses on pediatric or children's plastic surgery. We offer a full range of conditions here at Jalila Children's. Cleft lip and palate is a common condition that we treat, and we offer the full team approach. We also treat children with abnormal head shapes like craniosynostosis. We are the only team in the country that offers minimally invasive or endoscopic craniosynostosis. The way we do it here is by doing a small surgery, and the child then goes into a special helmet for the next 12 months. We also offer children's hand surgery, children's nerve surgery for children with nerve disorders following traumatic delivery. We offer burn reconstruction. We offer scar revision, hand surgery, breast surgery, and the full range of reconstruction following burns and trauma.
Our goal at Jalila Children's Hospital and Pediatric Plastic Surgery team is to make children look normal so they can function normally. As the only pediatric specialized hospital, we can offer the full range of services, as we are privileged to have the whole teams in-house, so we can interact with them, provide the best quality services to our children.
At Jalila Hospital, as a wound care specialist, we are providing high quality of service using a high septic technique, and also we're using the pain management to reduce the suffering for patients. We are using the latest product for our dressing change to enhance the wound healing and to reduce frequency of dressing change in our clinic.
We advise families to visit Jalila Children's Hospital for medical assistance. Our plastic surgery team will provide the best quality for their children's outcome.